We have this incredibly bloated financial sector. It's a phony crisis. They don't have to be cuts. We know how to get out of a Great Depression. You spend money. If we take a look at the typical worker, they're not doing fine.
Hi, I'm Dean Baker. I'm your host for Mostly Economics. Today we have with us Sarah Lueck, who's the Vice President for Health Policy at the Center for Budget and Policy Priorities. Thanks for joining us, Sarah.
Thank you so much for having me.
So we have a lot going on. Today is day 21 of the shutdown, and healthcare, the Affordable Care Act, has been front and center in that. So let me just start by asking you, what do you see as the importance of healthcare, in particular the Affordable Care Act in the shutdown?
Well, there's such a timely issue here before us because there are important premium credits that help people afford coverage in marketplace health plans. And those enhancements are set to expire. And so that people are looking now for plans for 2026 and seeing very high prices and beginning to make decisions about whether they're going to get coverage or not. So there's urgent action needed in Congress to extend those premium tax credit enhancements and avoid big premium increases for people as they're looking for coverage. So I think it's becoming an issue in this current shutdown debate because Democrats have raised it. Increasingly, number of Republicans are questioning whether they might be able to do something here. So we'll have to wait and see how the debate plays out. But there certainly is a time restraint here. The more time goes by, the more people who will be kind of looking at the plans and deciding that they can't afford it, and then it's very difficult to get them to come back. So the risk is really high that people could become uninsured.
Let me ask and get upset about this with the budget because it's common. I do it, you do it, we all do it. I'm sure we throw out really big numbers, and they're tend to be almost meaningless to people because not many people are budget wonks. So what sort of money are we talking about to extend, if we're to extend the enhanced subsidies that we're talking about that were put in place in 2021?
Yeah, I think the cost is estimated at about $35 billion a year. It's 22 million people, 24 million people now are enrolled in the marketplaces, and 93% of them are getting premium credits. So it's quite an important, large program now, and it's expensive because it has, it's private insurance, and private insurance is expensive, and those of us that get it from our jobs, it's also quite costly. So that's the way that it is, and individual people, I think, here would be bearing too high a cost to make sure that they could get coverage if they didn't get this extra help.
Well, let me just, because I like to do this, $35 billion, it's about half of 1% of the budget. So it is a lot of money. I'm not going to say this is a trivial sum. It's about half of 1% of the budget. And, by comparison, it's not entirely apples to apples comparison, but it's been in the news that President Trump, or I guess maybe Treasury Secretary Bessent, wants to give a swap program with Argentina of $20 billion. So again, that's not entirely apples to apples because that's, at least in principle, a loan, although we could end up losing a lot of money on that. But in principle, that's a loan. And in principle, it's a one-time. But again, we don't know that for sure it will be one time because if you make a commitment once like that, you could be back again and again. So anyhow, I'm not saying this is a small sum of money, but just to put that in some context, this isn't a budget breaker. We're not going to have a huge deficit if we do it and balanced budget if we don't. So let me, we've had this issue raised, and certainly the Republicans have made it front and center about the big problem is that undocumented, or they like to call people illegals, but undocumented people getting healthcare through the Affordable Care Act. Is this a real concern? I mean, whether you think it's a good thing or bad thing, is that what's going on?
No, it isn't. I mean, people who are undocumented, don't have lawful status, are not eligible for ACA marketplace, the premium tax credits. They're not eligible for Medicaid or Medicare. That was true before the Republicans passed the mega bill in July, and it would be true if all of those provisions, of that bill were repealed. Undocumented people aren't eligible for those programs. So the enhancements of these premium credits that are at issue right now and that are, at risk of expiring and raising a lot of people's premium costs, those are for people who are U.S. citizens. And actually the mega bill narrowed quite a bit eventually who can get those tax credits. So a lot of folks who are lawfully present in the US and living and working here legally who have immigration statuses that don't fit this more narrow description in the mega bill are going to lose their coverage eventually under the provisions of that bill, because there's new restrictions that really narrow it down to US citizens, lawful permanent residents, and certain other groups, and take away coverage from a bunch of people where there's long been bipartisan agreement that they should have access to services, like people who've gotten humanitarian protections, like refugees, people who've been granted asylum, and certain victims of domestic violence and trafficking. So the mega bill put restrictions in place on healthcare for people who are here legally. Their immigration statuses are legal. So the idea that people, either before or after who are undocumented are getting coverage is not correct.
Yeah, it is striking, and well, I guess it speaks a lot to what's going on. But that has been a major focus, and the one, at least as far as I know, the one small grain of truth to the idea of undocumented people getting care is showing up in an emergency room. That there was a law passed under President Reagan that requires emergency rooms to treat anyone in need of care, and that would include an undocumented person. And as I understand it, I think that's a sole grain of truth in the sense that we're providing health care to people who aren't here legally.
There's federal money that helps support when we provide emergency care to folks in emergency rooms in the way that you're describing. It isn't the coverage programs that we were just talking about precisely, right? So that is an important distinction, I think, in the minds of people that are trying to make this an issue. And I think that I think coverage is really important for all kinds of people, and actually people who are legally, lawfully here and their immigration status should get them access to benefits. They actually have a lot of trouble getting access to coverage even when they were eligible for it. And now these new restrictions coming into play under the new mega bill would make it even harder.
They haven't, and to my knowledge at least, they haven't proposed repealing that Reagan law on treating people in emergency rooms. But I just, you sort of wonder, like, how would that work if you did? I mean, obviously people show up in emergency rooms, at least often, in really bad shape. So, if you have someone who's a heart attack victim or, they've been shot or something, is the hospital supposed to ask for proof of citizenship before they treat them? I mean, it's, which,
I haven't heard anybody suggesting that our hospital should stop treating those kinds of emergencies and doing. I haven't heard that, and I hope that's not where we're heading at all.
Yeah, no, I don't think they would seriously propose it, just because it is pretty crazy. Yeah, but yeah, I'm just trying to think, if you did want to say, okay, we're not going to treat non-citizens who, people aren't here legally at emergency rooms. I mean, what would that look like? But yeah, thankfully, to my knowledge, no one's proposed that formally as legislation. But, who knows? So anyhow. So let's talk a little bit about what the Affordable Care Act has done. I mean, it's, the Republicans, again, I apologize for being too much on Twitter, but I mean, the Republicans trash it. It's been a disaster. It's whatever. So what would you say are the main accomplishments of the Affordable Care Act?
I mean, it had a huge impact on expanding access to health coverage in the U.S. Before the Affordable Care Act, so if we look back to 2010, 16% of our population, about 48 million people, didn't have any health insurance at all, right? And if you don't have health insurance, that obviously means you're at higher risk of medical debt, of not going and getting care that you need, of having your illnesses that you might have not discovered or treated too late. And then just, a lot of financial worry and burden that can come with not having access to health insurance. And so from 2010, it went from 16%, it fell all the way down to 9% in 2016 after the major coverage expansions under the Affordable Care Act took effect. So that's principally the Medicaid expansion that gave coverage to a bunch of low-income adults that didn't have access to it before. And then the creation of the ACA marketplaces and the financial assistance in the form of premium credits and cost-sharing reductions that's available to people who don't have other access to coverage. They aren't eligible for an employer plan. They aren't eligible for Medicaid or Medicare. And they didn't have a lot of good access to any way to get health insurance before the creation of the marketplaces, reforms of the insurance market, and then financial help to help folks that have lower and moderate incomes afford that coverage. So a huge reduction in insurance and uninsurance in our country. And, we've been at record low on insurance now. In 2023, it is under 8% on insurance, which is pretty remarkable. And then, that the fact of that also like it improved things across the board for like all kinds of different demographics, but it reduced inequities in access to coverage between racial and ethnic groups. It helped equalize access to coverage between rural and urban areas. So a lot of the problems and disparities that were seen before, and I can say, like, remembering back to that time, like if you didn't have insurance through your job or you weren't eligible for a program like Medicaid or Medicare, there just weren't a lot of good options for you. So that just provides a tremendous amount of access to care and financial stability for people that didn't have it before.
Yeah, it really has made an enormous difference. And, one of the things we were talking about this a moment ago earlier, that the Affordable Care Act, it radically transformed the insurance market in a way that I think a lot of people can't remember or don't, many of them are younger, they would never have seen it. But, before you had the Affordable Care Act, it was insurers could discriminate. They could say, you have a heart condition, we don't want to insure you. Or, we're going to charge you, $40,000. I had a friend's father who had a heart attack, and he was pre-Medicare still, and they wanted to charge him $40,000 for, I don't know what he ended up doing. He wasn't far from Medicare age. Maybe just wait till he hit Medicare age. But, they could do that. They could charge you crazy premiums based on your health condition. And, for just about everyone, obviously a $40,000 insurance premium, that's pretty much unaffordable unless you're just incredibly wealthy. So that was the insurance market. And I think people have a hard time understanding that just because it sounds so ridiculous today. People are used to the market we have under, with Obamacare.
It is pretty remarkable how different that individual insurance market is. As you said, insurers in most states used to be able to reject you from coverage based on like your health status. And they could charge you higher premiums, as you noted, and that required a whole and very involved application process where people were having to disclose all their health history and things that they had so that they could go through that underwriting process. There were also often benefits just totally missing, right? So the Affordable Care Act required a set of essential health benefits. It's kind of the basic things you would expect, but before that law was in place, a lot of times plans in that market would be missing, I think, what we would consider essential, right? So like maternity care, basically impossible to find a way to cover a regular childbirth. Treatment for mental health, for substance use disorder, really not available in the pre-ACA market. And prescription drugs would often be missing. They would cover some generic drugs, but sometimes the prescription drugs were just completely missing from the plans that you would buy, and you have to like pay extra for your drugs or buy an extra insurance plan to cover your drugs. So, it was just a very, very different world. And, even minor illnesses could mean that you wouldn't get coverage or you wouldn't get affordable coverage. So very common things like asthma, or I took an antidepressant 5 years ago, or, various things that are pretty common could make it very hard for someone to find their way to a plan. There were also really high deductibles. Insurers could limit the claims they would pay on a lifetime basis or an annual basis. So people with like very expensive things happening to them might find that the benefits just ran out. And then because the underwriting of health status was allowed, sometimes if you had a big claim, insurers would go and look more deeply into your health records and then find evidence that, well, maybe you had that problem before. So there would be these very complicated cases called post-claims underwriting, where people after the fact, when they thought they had health insurance coverage, would go through this process, and the insurer would say, no, we're not going to cover that because we think that this test you got 5 years ago, you should, your doctor probably told you had this and you knew it, and we're not going to cover that because this is a pre-existing condition. So just the idea that people that have pre-existing conditions or who don't have high incomes or don't have access to a job that offers health benefits have a place that they can go, is a really dramatic change. And the fact that it's somewhat consistent across states and that you don't have to wonder when you move, like, what am I going to find when I get there, is also a really, really big difference.
Yeah, no, it's interesting because, you hear a lot of people, mostly Republicans, obviously, but, yelling, well, we need the market. We shouldn't have, the government, obviously it's a big government program. You can't argue that. It's a big government program. We should just leave it to the market. And there's a basic issue here with how the market works with healthcare insurance. And I attribute this to Ken Arrow, the great economist in I think it was in the early 60s. He wrote a thing about why insurance doesn't work in healthcare. And it's this problem of adverse selection that if I'm an insurer, I mean, what's the insurer doing? They're trying to make money. And you don't make money by insuring sick people. I mean, it's kind of, put it crudely, but it's just kind of common sense. If you're healthy, thankfully most of us are, and they're very happy to insure a healthy person because the healthy person sends them a check every month and they go, thank you very much. And they don't have any claims or very few claims. And that's great for the insurance company. But when you have someone who's got a heart condition, who has cancer, who has diabetes, they have claims. They're seeing the doctor, they end up in the hospital, they have expensive drugs, and that costs a lot of money for the insurance company. So insurance company, to say they're bad guys, they want to make money. That's what they're there for. So they don't insure them, or they charge them a really high price. And that was the world before Obamacare. So it's fine to say I like the market. I mean, I study it. I think it's a great institution, but you have to regulate in a way that works to, accomplish the goal. We want people to be able to get health care. And, again, pre-Obamacare, what that meant was if you're healthy, fine, you can get insurance. But, the people who are healthy are the ones who actually, we don't need it as long as we're healthy. So it's kind of, you could send a check to the insurance company every month and that's great for them. But, in terms of actually getting health care, obviously it's the people who have health issues that really need it. And, again, that was the pre-ACA, pre-Obamacare world.
Yeah, it was a real wild west in those days, I think. It was very hard to understand what you were getting. And then, I think to your point, after the fact, I think after the fact of someone having a health issue, the insurer just had way more control over how much got paid out. So the law, the Affordable Care Act did create these marketplaces where people who don't have the benefit of being in like a different type of organized program through the government or getting employer plans have a way to get it, have a way to compare plans, know that the benefits are basically this, consistent across. Certain things are always going to be covered. And then there's some, sort of limits on how much the insurance company can charge, and the plans are organized in these meta levels. It's supposed to make it a little easier to understand what you're getting. So organizing those things and trying to help people figure out what they could get with what is frankly a pretty complex financial instrument or financial and healthcare product, right? And organizing that a little bit and then giving people help when they're at a lower or moderate income level with affording that. That's really the only way something like this, I think, could work. And it's by no means perfect, but having those kind of basic things in place was something, at least I don't take it for granted because it wasn't always the case. When I graduated from college and was working as a journalist, people knew I knew something about healthcare. They would call me before they were going to move for a new job or to go to school somewhere and ask, well, what's it like in the place I'm going? Like, what is the state what benefits am I going to get? What am I going to be able to find? And it was different everywhere. It was a total patchwork. And people that didn't have access to coverage through their job really had no option. So that is a huge change. It would be really, really terrible if it were undermined significantly, or if there were large numbers of people that couldn't afford their coverage. And there's a lot of talk right now that these enhancements are like they were supposed to be temporary. That these enhancements and the premium tax credits that are up for debate were COVID credits. That they were supposed to be temporary. In fact, I think there's some evidence that the federal marketplace, healthcare.gov, that their notices are giving that information to people that like this is supposed to be a temporary credit and it's going away. But like those of us who were working on the Affordable Care Act going into it, understanding the needs of the people that were left out of the system as it was before, we knew that as the law was passed, it wasn't enough. Like people at the very lowest income levels, people in the like near the poverty line, 150% of the poverty line, having to pay 2% or 3% or 4% of income at low income levels, that's a lot of money for someone with not very much money coming in. And if your policy goal is to make sure that people have coverage, then it is very important to make sure that even nominal amounts aren't preventing people from getting access to that coverage.
Yeah, and I recall when the Affordable Care Act was passed, and this seems like ancient history now, but Obama was determined that it came under a price tag. I believe it was $1 trillion, but I'm not, I could be wrong about the exact number, but they had a price tag that they decided was the maximum amount. And that was the basis for the subsidies and the exchanges. And they had a cutoff. And I remember talking to people in the administration that instead of a phase out, and I think it was at 4 times the poverty level. So for a single person, and you might know the exact number, it'd be something like 60,000. So you lose any subsidy above 60,000. Again, obviously not exact number, but a ballpark number. So what you might like to see is that, okay, you're going to phase it down, but because they wanted to stay within their limit, it was a strict cutoff. So again, I forget exactly how it went.
No, you're absolutely right. It was the way that the law was structured from the time it was passed until these enhancements came into place in 2021. There was this sharp cliff at 4 times poverty, which, yeah, you're right. It's about 63,000 a year now for an individual. So right then, not right at that level, people wouldn't be eligible for anything over that income. So right, they don't have a lot of money. If they're like, imagine a self-employed person making that much money, they wouldn't have gotten any help for these enhancements. And that was a pretty big deal. It was something we heard a lot from the public about and from policymakers about, that's really not fair, because people in that 4 times, 5 times poverty range, why were we making them pay the full cost of an insurance plan when most of the rest of us, pretty much everyone else in the United States that is eligible for some of these programs, is getting some kind of help, right? Whether from an employer, from the employer tax exclusion, from Medicare, Medicaid, other programs that are available. So why would somebody with sort of a modest income have to pay the whole thing on their own? So that was one of the elements in the enhancements that got passed in 2021, have been in place since then, that really helped. That if, nobody's made to pay more than about 8.5% of their income. So those people at that higher end of the income scale are contributing more of their income towards the cost of their premium. But there is a sliding scale that, in my opinion, makes way more sense than the sliding scale that we had in the underlying original ACA. That a lot of us felt like the lower income people, in addition to those more moderate income people at the bottom, a lot of those folks, if they were in a state that expanded Medicaid, they wouldn't pay any premium because their state's expanded Medicaid. So some of those folks that are getting $0 silver plans now because of the enhancements are people who in another state would be able to be getting no premium coverage. So it's a recognition that for people at different income levels, there's just a different level of affordability and ability to pay. And for some people, even a small amount is too much. And if the policy goal is to make sure that people have coverage, and it's really important to both make it affordable and reduce the barriers that come along with having to pay that premium.
Yeah. And that's, again, it's people are talking about at the higher end, the subsidies. These are not wealthy people. I don't think anyone in their right mind would call someone earning $65,000 a year a wealthy person. And it's kind of striking to me when you get the tax debate, when we talk about raising taxes, and, with Obama, Biden, they said, well, we're not going to raise taxes on anyone over 400,000. Under 400,000. And, there was some pushback. Well, 400,000 doesn't make you rich. And go, okay, we could argue whether 400,000 makes you rich, but it does make you a lot richer than someone earning 60,000. So,
Yeah, that's right. I mean, there's a lot of conversation about this right now. And frankly, there's some misleading claims being made about you could get a credit if you have $600,000 in income, but the JCT confirmed nobody is getting this credit that has that high of an income. Higher income people have way more access to employer sponsored coverage than lower income people do. So they're much more likely to be getting it from their job than from the marketplace. And then the structure of the ACA credit is already phasing out naturally. And it already is very well targeted to the people at the lowest income levels. And we saw that in the, enrollment growth that has been prompted by the enhancements. The enrollment growth has been concentrated in the last 4 years among low income people, precisely because it wasn't affordable for them before. These enhancements helped improve the premium tax credit so that it was more affordable, and they vote with their feet. They have signed up for coverage. And if we take that away now, it really will result in coverage losses, and they will be heavily concentrated among low income people.
One of the, stepping back a little bit from the specific case, or, the impact of the enhancements, the Republicans keep insisting that Obamacare is unaffordable, the ACA is unaffordable. And I was actually struck, you're probably more familiar with the data than I am, but, I looked at this a couple of years ago, what's happened over overall healthcare costs. And I was actually quite surprised, I'd even say shocked, that if you look at healthcare cost growth from 2000 to 2010, the passage of the Affordable Care Act, it increased by, I believe, 4 percentage points of GDP. I won't swear there's an exact number, but it was roughly that. So in other words, healthcare costs were rising very rapidly. Then from 2010 to 2024, they increased it again. I won't swear by the exact number, ballpark number. I believe it was 1.4, 1.5 percentage points of GDP. Now that's not trivial. So it's increasing as a share of GDP. But compare that, it increased by something like 4 percentage points in 10 years, 2000 and 2010. And then we have 14 years where it increased by 1.5 percentage points. That's a big slowdown. And I looked at the projections that we had at the time Obamacare was passed in 2010. Costs grew far less rapidly than anyone, and when I'm saying anyone, whether it was the Obama administration, whether it was the Congressional Budget Office, whether it was the Center for Medicare and Medicaid Services, all of them were projecting much more rapid healthcare growth than we actually saw. Now, I don't know why. I'll go beyond saying I don't know. I'm sure the Affordable Care Act was not responsible for all that slowdown in healthcare cost growth, but that is the reality, that healthcare cost growth slowed sharply after Obamacare was passed. So the claim that it's unaffordable, I mean, this is 180 degrees at odds with reality. Cost growth.
Yeah, no, absolutely. I think what you're saying, it just points to there being really no evidence that the ACA caused cost increases, right? And it doesn't mean that like everything's, so that claim is just unfounded. Like it didn't do that. I think when people sometimes cite numbers in cost increases about premiums in the individual market, the big jump in premiums, underlying premiums, happened when you bring a lot more people into the market that couldn't get coverage before, right? That had a lot more health conditions that they were excluded before. So there was a double-digit increase in underlying premiums in the individual market, but that's to be expected. Like that is, so sometimes we see data, we see the data that you just cited, right? That definitely does not show that there was any cost increase as a result of the ACA. And then it would be misleading to say, oh, well, let's compare premiums from 2012 in the individual market to premiums after, because as we just talked about, the market is vastly different. We're making sure that insurers have to cover people. They have to cover a certain slate of benefits, and they don't have all the ability to limit what they're able to pay on claims because the rules of the road were changed so that we, have to make sure that people can actually access healthcare under these plans. And that does cost money.
Yeah. And again, you just go back to the pre-Obamacare world. Yeah, you could have a plan with, minimal benefits and, excluded people who had health issues, and it would be cheap because they weren't providing care to anyone. I mean, it's a little silly, but I mean, that was the world. I mean, I can get a healthcare plan and I'm healthy and, it'll have very limited coverage and sure it'll be cheap, but it's not really, if I were to get a serious illness, it's not going to do me much good. And,
right.
That was to a significant extent, at least in the individual market. Again, most people were getting covered through their employer. But that was, if you're in the individual market, that was what you had to deal with.
Mm-hmm. That's right.
That was another aspect of the plan that I did know people, and I'm sure you knew more in the Obama administration, for that matter, the Biden administration. They didn't take credit for stuff, but one of the things that was supposed to happen, if we're saying, okay, think of good things in the world that would come from having the extension of healthcare coverage. One of the things that would happen was that we would reduce job lock. So this is, talks about job lock anymore, but this was the idea that you have a health issue or someone in your family, your spouse, a kid has a health issue. So it's very important that you stay at a job that provides you with healthcare insurance, because if you quit your job and your new job doesn't provide you insurance, or you want to start a business, you're going to be in the individual market and they're going to say you got a health issue, your spouse, whoever, so we're going to either not provide you insurance, you'll get some crazy premium. So one of the things that was, at least many of us hoped would happen is that it would reduce the extent of job lock. And I haven't looked at all the research on that. So I haven't, I looked at the research before. I'm sure people have done subsequent research, but one of the things that just jumps out at you can look at self-employment. That rose quite a bit. So people starting their own businesses, saying that they're self-employed, that rose, I think it was about 8% in the year or so after the exchanges came into existence, which to my view is a really big deal. I mean, this means people who wanted to, I'm not the biggest proponent of small businesses, I just say if people want to start a business, we should make it possible for them to do it. And the Affordable Care Act did. We just have the numbers. People voted with their feet. And I never got a good answer. I harassed the people I know in the administration. How come you're not talking about this? And I never, for whatever reason, at least maybe I missed it, but I really didn't see the issue.
The issue of the day with these enhancements is bringing to light a little bit more prominently who are these people that are covered in marketplace plans. There's way more of them than there used to be. And I think the fact that the affordability in that market is threatened because of, we're waiting to see what Congress will do here. That's putting more attention on who is benefiting from the marketplace plans, who's benefiting from these premium credits. And we know that self-employed and small business owners are disproportionately represented in the marketplace, right? It's for obvious reasons. They're less likely to have employer-based coverage. So they need something that, like this. This is why this was created. And to your point, there is evidence that job lock was lessened after the ACA. And I think we see now, there's 5 million small business owners and self-employed workers in 2025 in the marketplaces. And we hear from those folks when we're talking to them about this and what it's like for them. This is really essential. I mean, this is like rideshare drivers and mom and pop shop owners. Like, this is the kind of people that are getting coverage in the marketplaces, and they wouldn't be able to do it without some help paying for it. That's really the key. Affordability makes all the difference. It's the major reason people say that they don't have insurance before the ACA, the major reason they say they don't have it now. So this debate around what happens with the premium credits and should we be helping to support this coverage, it really is a small business issue and an issue for people who are self-employed. So it definitely does take a lot of fear away to have that financial assistance there, but also all of the reforms to the insurance market that we were talking about before, because I think part of it also, the fear and the job lock problem, was related to people not knowing if they would be able to get a plan because of their pre-existing conditions, or being afraid that if they did do that and take that risk, that if they got sick and needed care, that they wouldn't have protections that they needed. And they were right at that time, because the rules were not in place to create, a more secure market. And we are much better off now than we were then.
Yeah, it's as I say, it's the success of the ACA is almost undermining the case, because again, a lot of people, they have a hard time. They think, and again, I'm sure you've had more conversations like this than I have, but they think you're making stuff up when you say that, insurers aren't going to insure people who are sick. You aren't going to insure people with health conditions. And, I think people, it's been 15 years now we've had the Affordable Care Act, or I guess 14. And, you're referring to a world, well, one, it's a distant past, and two, younger people didn't live through that. So they're unfamiliar with that.
And it was also before the ACA's requirement that young people up to age 26 can get on their parents' plans, which has been a huge boon to insurance coverage, access to insurance coverage for folks in the marketplace, but also beyond, right? In employer coverage and in other types of coverage. That's like a really important thing where I do think that it's easier to take it for granted now, because that is a really important time of life when it can be very hard for people to access coverage or afford coverage, and folks are just starting out. And we know from talking to young people that even though they might seem like they wouldn't need coverage or they wouldn't use coverage, they actually do. They actually have things that they want to be able to have access to, and having a robust plan that actually covers the benefits that you need and helps you afford getting care, that's really, really important.
Yeah, and of course that proved the coverage age 26. That proved, again, ancient history it seems, but by chance, not totally by chance, the Obamacare Act, of course, passed in 2010. We're very slow recovery from the Great Recession, and young people, of course, have the hardest time getting employed in a downturn. So it was actually a real boon to a lot of young people that they were able to be covered on their parents' plan until they might have found a job where it did cover them, or the economy did ultimately improve. It was slowly, much slower than anyone wanted, but it turned out to be, the timing turned out to be very good that we extended coverage just then.
Yeah, that's right.
Unfortunately, we might be in the same story now with unemployment rates, as the labor market's weakened. I'll just say that the unemployment rate for young people has risen a lot in the last year. So again, we're probably seeing a lot of younger people that are being covered on their parents' plan that may not have been the case a couple of years ago.
Right. Yeah. I mean, it's a really important thing to talk about, this like immediate issue of what happens with this group of people in the marketplace, which is quite significant. I think I would have rather been having a debate about how to make things better rather than defending against losing something that seems pretty basic. Because there is a lot of need to make sure that people have improved access to affordable healthcare. There, a lot of frustration with people not being able to get providers that they need, regardless of what kind of health insurance they have, right? Or having trouble affording things. So this is a must-do item to my mind, to make sure that the premium credits as they are now remain intact, and that we can help avoid millions more people becoming uninsured with some action soon, hopefully. But yeah, there's also a lot more work to do.
Let me ask you a question. You may not feel comfortable answering because I have no idea myself, but where do you see this going? Do you think there'll be a compromise? Is it, are the enhanced premiums dead? Enhanced subsidies, I should say, dead? Or what do you think is the outcome? And again, it's fine if you say you have no idea, because my answer.
Yeah, I mean, I don't think any of us know. I don't know. I think we're in that phase of a debate where the pressure is mounting. And because, people who are enrolled in the marketplaces, in around a dozen places around the country, they already have access. If they go online or they get a letter from their insurer, they're already starting to find out what their premium costs are going to be in 2026 without action by Congress. So they're already seeing, a big increase potentially, right? I think on average, it's like 44% increase. So hundreds or thousands of dollars in some cases, depending upon where you live, how old you are, that sort of thing. So people are already coming in contact with the harm of these enhancements expiring. And as that happens more, the pressure is building on policymakers to realize this is an urgent issue and to understand the extent of the problem. Maybe they didn't know how many people in their state or in their district were getting this coverage. Maybe they didn't understand how important it is to small businesses or self-employed people. Maybe they didn't, I think it would be great if we kind of get out of the old ACA repeal and replace debate and more into like, this is just a thing that people have access to, millions of people around the country. And if they have their premiums go up, a lot of them are going to become insured. We know from talking to enrollees that, many people really want to keep this coverage and will try to find a way to afford it if the enhancements expire, but they're worried about how to afford that and balance that with other basic needs when they're experiencing increases in other costs like rent or transportation, like things that they need to live their lives. This is an added pressure. So making sure, I think people already have a lot of skin in the game when it comes to healthcare, and making sure that there's action here to make the price increases less, protect people against those big premium shocks, and make sure that they get coverage is really, really important. I think as the pressure builds, I would like to think that the policymakers will hear that call and begin to understand how important this is as a source of coverage for people, the variety of people that are covered by it, and how successful it actually has been. But I don't think we know yet. I think that we're in the midst of finding out whether that cry for help, that call for action from the people that are impacted, and policy folks that are watching it and saying, like, this is what's going to happen if this isn't resolved. Hopefully that will change people's minds and get them to come to the table and figure something out. So we'll see what happens. I don't actually know how this will end, but I think the longer they wait, the worse the problem becomes, the more people we risk having no coverage, losing them and not coming back because they think it's too expensive for them. So that is really unfortunate. It is urgent. It needs to happen quickly. It is hard to see it happening really quickly, but every day that goes by, it's sort of more people are getting impacted. So it feels to me like something that the pressure is building, and hopefully it will lead us somewhere better.
Yeah, getting cut off from insurance is not a nice holiday or, we'll say, Christmas present. So
Right.
Well, thanks a lot for joining us, Sarah Leek, and we'll have you back on and talk about good news, 6 months or so down the road. Well, hopefully before that we get a settlement here, but it'd be great to have you on again. So thanks for joining.
Thank you so much for having me. I really appreciate it.
If you like what you just saw, please help us out by liking us and subscribing. Thank you.